My colleague from West Covina, in his very impassioned speech, talked about the impact on the Medi-Cal population here in California and referenced our responsibility to take care of the least of these. But colleagues, as budget chair and someone who's worked in health policy most of my professional career, I would argue, particularly for those whose voting history would not suggest that they are particularly supportive of Medi-Cal or poor people in general, I would argue that it goes beyond the Medi-Cal program and the Medi-Cal population. Yesterday, the Community Clinic Association was here walking the halls, and there are community clinics in all of our districts across this state. If you have a DSH hospital, a disproportionate share hospital, in your district, you will hear from them soon. I would argue, colleagues, that the entire infrastructure of our health delivery system as we know it, not only in the state of California, but across this country, will be compromised by the decision made in Washington, D.C. today. And if you don't believe me, call your hospitals when you get home to your district today. Call your community clinic directors and ask them what portion of their client base are Medi-Cal recipients. Many of you stand up when we talk about access to care and making sure that Medi-Cal providers get a reimbursement rate that's fair and appropriate, and you stand up for that. And so how, in your mind, is that consistent with the vote taken by Congress today? So whether the Medi-Cal population is on the top of your list as communities that you support, I think you should educate yourselves and think more broadly about the core infrastructure of the healthcare delivery system. And see if when you come back Monday, you haven't heard from people in your district about how this vote will compromise their ability to provide care for all Californians, the veterans we all speak so passionately about, the unborn babies all of us speak so passionately about. I think we need to be clear about the broad scope of this decision made by Congress. Secondly, I just have to, like many of my colleagues, tell a story. Dr. Hernandez and I held a women's health town hall in his district in East LA Community College. And that's where I met Novelyn Aquino. Novelyn talked about having been a Planned Parenthood patient as a young woman, but as she married and her family grew, she was able to have workplace insurance. Well, there was a gap in her coverage. How many of us have faced that? It was just at the point she had the gap in her coverage that she detected a lump in her breast and thought, what do I do? And she knew, based on her Planned Parenthood experience from decades prior, that if she went to Planned Parenthood, she could get an appointment the same day. And Novelyn stood there as a breast cancer survivor and shared with us that if it wasn't for her ability to access services at Planned Parenthood for a breast screening and treatment, she wouldn't be there. So as we so cavalierly lie and misrepresent the statistics about the services Planned Parenthood represents, as we so cavalierly misrepresent the fact that public dollars don't pay for abortion services and haven't for decades, remember the women like Novelyn, who, for whatever the circumstance may be, rely on the community clinic, which is what Planned Parenthood clinics are, rely on those services for life-saving treatment. As we talk about Planned Parenthood, I'm always amused when I think about my experience in Dirty 30, biology as an undergrad, Mr. Bradford, and I think about, women don't get pregnant by ourselves. And so I'm not sure why the fellas are always so transfixed about women's reproductive health services. How about you let me, as a woman with a uterus, decide what kind of services I need and should be entitled to? How about that? We have all talked about what this will do to the healthcare delivery system in the state of California, and I want us to go back to our districts and be ready to look constituents in the face and explain to them why that was a good action taken by Congress. Justify that to the directors of the DSH hospitals and the teaching hospitals and the community clinics and the Medi-Cal providers who we haven't reimbursed at a reasonable rate in decades. Be prepared to explain how this action will work to the benefit of our constituents. I know I can't, nor will I try.